A very pleasant good afternoon to all of our viewers. Welcome to Let's Talk. We are delighted to be with you on SLC Adventist Today. And today on Let's Talk, we have a very interesting discussion. We're going to be talking about reproductive technologies. If you are married and you cannot have children, or perhaps you know someone in that situation, I believe this topic would be especially meaningful to you. The question really is, should you just be content and say that that's God's will, or should you use the available technology? Is it okay to use the knowledge that God has given us, or is that going too far? With us to talk about the issues this afternoon, we have a special gentleman. I want to introduce him to you just after we have a word of prayer. So we would like to invite you at this time to bow your heads with us as we have a word of prayer. Almighty Father and our God, we pray that you will be with us, with all of our viewers. We are discussing a very important, very sensitive topic. We ask for your wisdom and your guidance. Take full control and have your own way. In Jesus' name, amen. So welcome again to all of our viewers. This afternoon, we are talking about reproductive technologies. With us this afternoon, as I indicated earlier on, is a very special guest. I'll introduce him now. He is Dr. Samuel Brown. Dr. Brown is the medical director of Brown Fertility. He completed his reproductive endocrinology and infertility fellowship at the renowned Jones Institute for Reproductive Medicine under IVF pioneers, Doctors Georgina and Howard Jones Jr. He is duly board certified in obstetrics and gynecology, as well as reproductive endocrinology and infertility, providing patients with more than 20 years of training and experience. Dr. Brown is an acknowledged leader within his field and has been directly involved in the management of more than 10,000 in vitro fertilization cycles. He was also the first surgeon in the state of Florida to pioneer minimally invasive robotic gynecology surgery for the treatment of infertility. He has successfully completed over 2,000 hospital-based surgical procedures, including extensive experience performing tubal reversals. I hope we do have a time to talk about the area of tubal reversals. Dr. Brown, we are so delighted to have you. We know that you're an extremely busy gentleman. You have a number of facilities across Florida, and that you have taken the time to be with us this afternoon. I truly appreciate it. Welcome, and please say a word of greeting to all of our viewers.
Thank you, Dr. Greene. It is my privilege to be with you today, and we appreciate the honor to spread the word scientifically and God-based in regard to what we do.
All right, well, we want to begin, Dr. Brown. We're talking about reproductive technologies. You know, my first encounter with the need for this conversation and the seriousness of how some people look at it. I remember one day in my pastoral ministry, I was traveling to Antigua. I was working outside of Antigua, and I was passing through on vacation when I got a call from a certain member, and the individual called me and said, listen, you folks need to develop a ministry to deal with people who cannot have children. It's quite a challenge. It's very depressing. And I began then to think about, you know, how it must be for somebody who wants to have a child and can't get a child. Well, let's begin this way. When God created mankind, Adam and Eve, he blessed them and told them that they were to be fruitful and multiply and replenish the earth. That means that they were to have children. So we can say that having children is a gift from God. I do know that it can be very disconcerting, as I said before, when couples discover that they cannot have children. Now you, Dr. Brown, is someone who helps people who are not able to get children. Let me start by asking, how did you get into this field? What was your inspiration?
Thank you, Dr. Greene. As a scientific-based physician, I was always very interested in the beginning of life. What is life scientifically, and chemistry, biology? It always interested me, and not the other end of medicine that involves the end of life care, but I enjoyed the beginning of life care and babies and families, and it was very interesting to me, not only helping couples with family creation, but also the science involved. You know, what was God's recipe on how did this happen? What is life? So it was very intriguing to me early on in my career, which led me down a path of a very scientific area of medicine and microbiology called reproductive endocrinology and infertility.
Okay, very well, interesting. Now, you are the director of Brown Fertility Treatment. Tell us a little bit, what services do you offer to your facility?
Sure. As an infertility specialty group in Florida and South Georgia, you know, our goal is to help our patients coming suffering with infertility, and they have the hole in, and they have a lot of distress in regard to infertility and desire to have family. So what we provide is full spectrum care. We help them with, here's my son. We help them with infertility treatment in regard to simple treatments such as surgeries to correct problems, or inseminations, or even things such as IVF, or we call assisted reproductive technology. So we're a full spectrum fertility group to help couples have families.
Okay, so if I realize that I cannot get children, then I come to you to seek help. Let's now, before we talk about the how and the ethical dimensions of fertility treatment and what methods are available, let's deal with some basics. What are the factors that people or why people may not be able to have children? What are some of the things that may contribute to that?
Yeah, it's a good question. When it comes to infertility, there's two main groups. It's a couple's problem. It's not just a woman's problem or a man's problem, but it is both. Where half the time it's the male and half the time it's the female. So it could be at low sperm counts in the male, and in the woman it could be low egg counts. It could be that her tubes are blocked. There could be fibroids. It could be an age issue. So it's very common, or it's not as straightforward as just a woman's problem. It's actually a couple's problem typically.
Okay, so on the side of the man, it could be an issue with low sperm count. On the side of the woman, you said that the tube could be blocked. Somebody once, well, I've heard, you know, there are lots of discussions. Some ladies, when they get married, they begin by using contraceptives, and depending on the type of contraceptive, when they're ready to get children, they can't. Is that a plausible theory that using the contraceptive pill, for example, that it can interrupt the female cycle and interfere with her ability to get children afterwards?
It's a good question, and we get that quite often. You know, couples that have used contraceptive methods, they fear that somehow will cause infertility. Typically contraceptive methods will not cause problems, such as like birth control pills, for example, too long. Now it can take a couple months where ovulation becomes normal again. So after stopping birth control pills for the woman, but typically within just 2 or 3 months, the woman's back to being ovulatory. And the other forms of contraception, such as IUDs or condoms, no, they don't cause any harm whatsoever. So no, I don't. I think in general, contraceptive choices do not cause infertility. And you're right, that is one of the first questions we get from patients.
Okay, here's another question. I studied in biology that in the case of a man, his scrotum is outside the body because the sperm production requires a lower temperature than the body temperature. So does wearing tight or excessive clothing interfere with sperm production, and can that lead to impotency?
That is one of the first questions. One of the first tests that we like to obtain, and you can now get these tests over the counter in a pharmacy, is just a sperm test. And yes, in the gentlemen that have low sperm counts, and it can come from tight garments or working in hot weather, the sperm count can be lower. So we'll recommend that the gentleman wear boxers, keep the scrotum as cool as possible, hydrate well. So yes, in hot climates that can be an issue. And that is one of the first recommendations to wear lighter or looser garments such as boxers. You're right.
Okay, very well. Now, Doc, when a patient comes to you, they say, I can't have a baby. Talk us through what happens.
Sure. All of our patients come in, we call them the walking wounded. They're suffering. They've admitted defeat to themselves, or that they have a problem, and they're vulnerable, and they're hurting, and some handle that better than others, but they have enough courage to come and sit in front of a professional, and we either do that by telemedicine, like now it's easier with the coronavirus. It's made using computers an easier world to communicate. But patients will come in, and usually it's a husband and a wife, and they will say that they have a problem, and they don't quite know how to voice what their problem is. And then we direct them with questions. We know how to ask, like, how long have you been having unprotected intercourse without getting pregnant? How many miscarriages have you had? Do you have pain with your periods? Have you had a history of sexually transmitted infections? We have directed questions that we ask them. So we make it pretty easy for them. And typically just after that 30 to 60 minutes of just talking, we can usually figure out what the problem is. And then the patients, they feel a little more empowered. They feel hope after that first new patient interaction, where we reveal to them, typically from that interaction, what's going on and what tests need to be done. And and patients feel quite a bit better afterwards. But just getting them through the door, just getting them to make that telemedicine consult is one of the most challenging parts. Just the courage to talk to a professional about this.
Doc, from your perspective, is this a common problem that people are not able to get children?
It's a great question, Dr. Greene. Yes, it's 10 to 15% of the population, at least in the United States. And we think that's the same in most countries as well. That's a lot of people. It's more common than most infections, and 10 to 15% of the population. Now, it's very related to the woman's age. For example, if a woman starts to have a family at age 40, 50% of the time they will have infertility. But if the couple comes in and the woman's 30 years of age, it's more like 15% of the couple, or just in general, 15% of couples where the woman's 30 years of age will have infertility. And to phrase that differently, for 40-year-old women that start to have a family, just in general, 50% will have infertility. So it's very dependent on the female's age. And that's all because a woman's born with a set number of eggs. And the good eggs that will make babies typically are depleted by age 40 to 44. After 42, there's a rapid drop in fertility rates. So it's very age dependent, especially on the female.
So from that information, it's safe to say that if you want to have a family, it's a good idea to start young.
Absolutely. And the general recommendations, at least from the American College of OB/GYN, is if couples are desiring a family, they should try to start as soon as possible, as early as possible, and not delay until when the woman's in her late 30s, where it becomes more challenging. So we like to say less than 35 is a good age to start a family for the female.
We have a situation these days where more and more women are going into careers, and they are deciding to delay issues of marriage and family life until after they're finished with their education, establishing themselves. So it does appear that if they are interested in establishing a family, they need to seriously give consideration to how they would balance their career versus family life.
Absolutely. Career-driven women will delay their fertility and their families. And you're right. And they're usually pretty smart women, and they know that they're maybe pushing it to some degree. Yes, and especially women that delay having family after age 35, it can be challenging. So there is a large push for fertility preservation in career-driven women to consider freezing their eggs before age 38 or 37. And they can freeze their eggs for future use if they're not in a relationship and they desire children later after they finish their career development. So fertility preservation's, there's a large push for that in the United States currently and around the world for career-driven women or couples.
It's interesting that you said that about freezing the egg, because I was about to ask you, what are the options of fertility treatment? If we get into maybe defining some terms, you just mentioned that women can freeze their eggs so that a woman may know that she is going to be focusing on her career, and she may say, hey, listen, just in case I want to have a child later on in life, let me go ahead and freeze my egg. What other options are there?
Yeah, that's a great question, Dr. Greene. So fertility preservation there's a large push for this around the world. For women to be empowered or couples to be empowered with this science, I suppose. In general, men don't have to, men are fortunate in that they continue to produce sperm until their 70s and 80s. So they don't have to worry about cryopreserving their sperm in general, unless they're about to undergo chemotherapy or some type of treatment that will hurt egg or sperm production. For women, it's different. Women are born with a set number of eggs. And we know that after age 35, there's a rapid decline in the quality of those eggs that would make a baby. So the science has shown that for women under the age of 38, egg cryopreservation is a smart option if they know that they don't want children until their 40s after career development. And women that are between the ages of 38 and say 42, it's recommended, especially if they're married, to go ahead and retrieve their eggs with a needle. It's a very simple process. Fertilize them with the husband's sperm, and then cryopreserve them and store the embryos for future use. It's very interesting because once they're cryopreserved, they don't age, they don't freeze or burn. And then when they use, for example, a 39-year-old woman that was not ready for a child, if she retrieved her eggs with a needle and then fertilize them with her husband's sperm, she can freeze that fertilized egg, or what we call an embryo. And then later at age 44 or 45, the pregnancy rate will be as if she was 38 or 39, which is amazing. So okay, she can really preserve her fertility till
I would like us to discuss that a little more, because you're going into an area, you're giving me a lot of information there that I wasn't aware of. So just to back up a little bit to make sure I got you correctly, you're saying the fertilization can take place and then freeze the embryo.
Yes, and when we the science of cryobiology, where we cryopreserve a fertilized egg or what we call an embryo, it's very stable and very good, where 5 years later, 10 years later, 20 years later, there's been shown to be no harm whatsoever. And then when you thaw that embryo and put it back in the woman's womb, the pregnancy rate will be as if she was the age when we froze the embryo. So if she was 38 years old when we froze an embryo and we put it in her 45-year-old uterus, the pregnancy rate will be as if she was 38, which is wonderful and much better. For after age 40, it turns for really bad.
Now, what I'm not understanding though is, why is it if the egg is available, it's frozen, and it is fertilized at the time when she is
a more fertile age,
and then frozen, why is that a better chance than if it is fertilized when she's 42? If we're starting with the egg that is retrieved at age 38?
It's a great question. And what the age of the egg is paramount. So when if a woman is trying to get pregnant at age 30 and she has 30-year-old eggs, the pregnancy rates are very, very good with the science that we have. And at age 40, it's not so good. It gets bad. And it's the age of the egg that matters. A woman's born with a barrel of eggs. And when she gets to be age 40 to 42, especially 44 is kind of the end of the road, where her eggs won't want to fertilize well with the sperm and become an embryo that will implant and make a baby. So the younger the egg really makes all the difference. The older eggs don't work as well at all. They really don't. So the age of the uterus does not matter. The age of the sperm does not matter.
Okay, so I'm getting it now that if you're married and you're planning to have children, later on, if you're too busy, you're saying to take care of children, to interrupt your career, etc., it's a better idea to go ahead and fertilize the egg and then freeze it.
Yes,
that's
absolutely. Especially when couples or women are approaching age 35 to 37 and they don't have a mate, then that's a serious consideration to consider cryopreserving their eggs before age 37, 38, or if they're in a marriage under age 40 to cryopreserve the eggs or fertilize the eggs we call embryos.
Okay, let's talk about the freezing process.
Yes.
I wanted earlier to ask you a question about the process of getting the eggs. So even before the freezing,
Sure.
How do you get the eggs?
Sure. So when it comes to fertility treatments, there's simple treatments that we have in regard to something called inseminations, where we just wash the husband's sperm and place into the womb or the uterus that will find the egg on its own and lead to pregnancy. That's called an insemination cycle. And then there's the more advanced science or treatment for infertility called IVF. And IVF is when we have the privilege of removing a few eggs from the woman with a needle from the body, fertilizing them with sperm, and then 5 days later, putting them back in the uterus. And it was invented for women that had bad fallopian tubes or really bad sperm, where we could, so the tubes are gone and missing, so we could pull the eggs from the body, fertilize them, put them back into the uterus where they're intended to be, and pregnancy rates are fabulous. And so those women before the era of IVF, which really occurred in 1980, they were not able to get pregnant. So now they can get pregnant with this technology that's pretty simple. Does that answer the question?
So I'm here saying, wow, how far have we come? Because when I was born, well, even way after that, having this discussion would seem like science fiction.
Right.
So we have come a long way with respect to what we can do. I'm really fascinated about the fact that you can fertilize the egg and freeze it there until
Yes.
you're ready for the baby. That's amazing.
It's such a blessing. And for couples that would not have had family or children, nearly most couples can have family with this science, but it's God-given science, and couples sometimes will mention, well, Dr. Brown, this seems scientific and artificial to me. And as a God-believing physician, as a God-believing scientific physician, I always explain to patients that, I wish we could be artificial. And I mean that in the sense that we use the products that God gives us. God gives us the technology and the understanding to obtain a natural egg and a natural human sperm that's God made, and have the technology to put them together. And we have the privilege of watching them become life or an embryo, and then putting them into a natural uterus. So to us, it's very natural. And we wish we could be artificial, in the sense that I wish we could make an artificial sperm or an artificial egg or an artificial uterus. We're not that good. It's all God-given, wonderful cells, sperm cells, egg cells, and uterus. And we're blessed with the ability to be able to work with what God gives us to help couples have families that otherwise would not have had families.
Let me go back to a question I asked you earlier just now, because I do understand now. We remember just a few minutes ago, I asked you about retrieving the eggs.
Yes.
Now, the matter of freezing it. So if my wife wants to freeze her eggs, well, we are beyond that. But what facilities do you have? Do you have like a storage where you have a bank where people deposit their eggs until they're ready for them?
Yes. So when it comes to fertility preservation, especially with women freezing eggs, they for example, they would fly to our Orlando office, and they would go through a 10-day process where we would, instead of having one egg be released from the woman that month, we might get 10 eggs. And then there's a process after we get the eggs from a needle that there's a special cryobiology process where we can freeze those eggs. And then they're frozen, we keep them stored in freezing containers or tanks. And it's a very well-developed science pretty much around the world, like in Europe and the United States and China and even South America, where these large storage facilities such as Reproductive will come and pick up the frozen eggs that are in these straws and keep them in these large hurricane-proof facilities with backup power and keep them frozen for years and years. And they charge the patient probably $200 a year just to keep them frozen, 200 US dollars. So it's fairly reasonable cost-wise. And then later in life, when the woman wants to have a baby, she can thaw those, fertilize them with the husband of her choice or what have you, and then put them in her uterus and have a baby, even at age 45 or age 50. So it works really well when the woman's under 38 to freeze the egg, the unfertilized egg. But when the woman's between age 38 and say 42, then the smarter scientific choice is to fertilize them and freeze them as embryos. Then they do better later when you thaw them. Yeah.
Okay, so I have two questions related here. What is, you partially answered one, so I'll ask that first. What is the oldest recommended age for a woman wanting to freeze her egg? And second question is, what is the oldest age of success in terms of reimplantation of the fertilized egg?
That's a great question, Dr. Greene. Let me kind of answer that in a different way. What's the oldest that a woman should get pregnant? You know, from our current medicine and science and our understanding, we believe that age 55 for a woman is the oldest that she should have a baby. And they've shown that if the woman's older than 55, she doesn't do as well. Like her heart and lungs can't keep up with the pregnancy, and there's increased what we call morbidity and mortality or problems. So the cutoff is 55 years of age. And now women between the age of 44 and 55, typically the only way that we can help them get pregnant if they have not frozen anything is with a donor egg or a donor embryo. So a younger woman that came through the IVF process, we froze her eggs, and then we can offer them to older women. Or couples that have gone through the IVF process and they have extra embryos in the freezer after they've fulfilled their families, they'll donate their embryos, and then couples can use frozen donor embryos. But again, that's for the age group. If the woman's between 44 and 55, either donor egg is, but before that, so the end of the road for a woman is typically 44 in regard to using her own eggs, not a donor egg. Between 42 and 44, there's a sharp decline, and this study has been done around the world over and over again, that those eggs don't want to do the job as well, especially when we consider 44 the end of the road for a woman. And age is a very powerful predictor on what's going to happen for a woman. But and of course, we all know exceptions. I know a 48-year-old woman that got pregnant with her own eggs, but I promise you less than 1% of women will get pregnant after 44 with their own eggs. So it's kind of a yellow flag goes up when the woman's between age 38 and 44. Even though we get the egg and the sperm, it still may not take, because the good embryos take and the bad embryos don't take. And what governs good versus bad is typically the age of the egg, not the age of the sperm. But under age 38, it's really good for the woman. If the egg is from a woman 38 and under, the egg is really good, and pregnancy rates are really good with either freezing their eggs or freezing. But between 38 and 44, freezing embryos is probably more recommended.
Okay, so that has to do with the retrieving of the egg and freezing the egg. Now, yes. if I'm a woman and I have my eggs frozen, what's the cutoff point for?
So for using them. So
yes.
If the woman has frozen eggs, and what's the cutoff? We believe scientifically it's 55 years of age.
55.
Yeah.
Okay. So the other day I heard on BBC, British Broadcasting Corporation, that there was this lady who was 62 that gave birth. We put that down as an exception.
We can still do that. No, we can help. It's fairly easy for us to help even a 100-year-old woman get pregnant.
A 100-year-old woman.
If she's alive and she has a uterus, we have the science where we can prime her with hormones properly and put a younger egg that became an embryo in her body. She'll get pregnant very easily, but unfortunately the pregnancy may kill her or cause major problems. So yeah, in other countries, they don't hold this moral or ethical limit, where we know scientifically the limit we believe it's scientifically shown at 55 and above can be very harmful for the woman to be pregnant. So we purposefully don't offer treatment, at least in the Western countries, to women usually over 55. But there's always exceptions. Like I heard of a woman in California in their 70s getting pregnant. And we have, yes, we can do that. But we have moral and ethical limits that we believe it's not healthy for the woman after age 55.
And we're going to talk about some of those ethical dimensions more next week. There are a few questions that are coming in a while. We will address some of the questions. But I want to go to the side of the male now, because earlier you said that a man produces sperm up to 70, 80 unless he is doing chemotherapy. So let's talk about that just a little bit more.
Sure.
Chemotherapy, you're indicating, can impact sperm production.
Yes. So it's interesting for men. They're very fortunate where men produce sperm actually up until their dying day, up into their 80s and 90s, and they are fortunate to continue to produce sperm, and the sperm is generally pretty good. It'll fertilize an egg. It's suitable, functional sperm. Now, the only exceptions to that are gentlemen that have had cancer or what have you that required chemotherapy, which kills those progenitor cells or the cells that make sperm. So chemotherapy can kill those cells. So gentlemen about to undergo chemotherapy, we generally recommend that they freeze their sperm for future use as well. Now, the other issue, and that's irreversible. So if the gentleman undergoes chemotherapy, most of the time it will kill the sperm product. It depends on the type of chemotherapy, but just in general, it's good to think this way, that it's going to permanently kill sperm production. So for those gentlemen, we'd like them to cryopreserve their sperm for possible future fertility. Now, there's an epidemic where a lot of gentlemen are taking testosterone, especially older gentlemen, over age 60 to 80. They may consider them having low T or low testosterone. It's very controversial how real that is, medically speaking. But the gentlemen that are on testosterone, it will make their sperm count go to 0. But that is reversible, though. However, gentlemen that take testosterone for bodybuilding, or if they're older gentlemen that just were told they had low T, we see this every week, Dr. Greene, where they come in, their sperm count is 0. Now, fortunately for these gentlemen, once we take them off the testosterone, within 6 to 12 months, their sperm production will come back to normal and they'll be okay. But not chemotherapy. Chemotherapy knocks it out. And the same thing for a woman. A woman with chemotherapy, it does hurt their egg supply as well. It doesn't hurt the uterus as much unless they do use radiation in the pelvis. So chemotherapy does also permanently, irreversibly hurt a woman's egg supply as well.
This is invaluable information you're sharing here, Doc. We really do appreciate this. So for all those men out there, if ever you have to do chemotherapy and you have a desire to have children later on in life, the idea is to get your sperm frozen.
Yes, and it's fairly easy to do, and there might be some logistical issues of flying to a city that can easily do that for you, and that's one of the reasons we have a large office at Advent Health actually in Orlando, Florida. We thought a lot of couples would like it as a destination to travel there, and they could cryopreserve their eggs or sperm and also have fun with the theme parks. But yes, so there's sperm cryopreservation, and there's egg cryopreservation and embryo cryopreservation that's available for couples.
I wanted to ask you that question earlier about your connection to Advent Health. You just mentioned something there, so if you can just highlight on that a little bit.
Yes, I've had a relationship with Advent Health for 14 years in Orlando, and just mesmerized by the blessings in working with the group. It's the finest hospital system I have ever worked with. They are better than the Mayo Clinic and other hospitals. And there's other good hospital systems in the United States, but Advent Health in Florida is just a blessed, amazing system. And I've been fortunate to see how they interact and work on a hospital level for almost 2 decades. What a blessed, incredible organization.
Okay, now, Doc, it's 3:36. We're going to begin to ask you a few questions from our viewers. Before we do that, however, I did want to just begin a little to look at the ethical concern. In fact, let me go straight to our viewers and get in some questions here, because we're coming back next week again. So let's see where the questions are.
But Dr. Greene, I would like to. You brought up a great point. Is this God's intent? Is this patients with infertility will say, was it meant to be?
Yes.
And I get that every day. And as a God believer, I have an interesting answer to that. We feel like God. I was actually invited to an Orthodox Jewish medical community forum, and I'm not Jewish, and I love those people. They're wonderful people, and I'll never forget. They asked me to give them a few really interesting fertility treatments, like using donor egg with a non-Jewish egg, and or using gestational carriers and surrogates, and I'll never forget. The response from the rabbis there. They flew in rabbis from New York City to have this forum. And again, I'm not Jewish. I'm a God believer. And they said, Dr. Brown, after I gave them a few examples of this incredible success stories from really interesting ways of helping couples get pregnant, I'll never forget the rabbi kind of shaking, and he was kind of rocking back and forth. And he looked up at me and he said, Dr. Brown, in our faith, it's okay to act or play as God. And I said, well, wait a minute. I don't feel like I'm God here. I feel like God gives us these tools and this understanding to help couples. We don't feel like we're acting or playing God here. And he said, well, you're right, Dr. Brown. He said, in Genesis, it says, God can give you wheat, and it's okay to create bread from what God gives you. So God gives you the wheat. It's okay for man to work with that wheat to make bread. And I said, oh, that's a fair comparison. God gives us the egg and the sperm and the uterus. And we can't make an artificial egg, sperm, or uterus, but we can help create family with God's assistance. So, and that's kind of one way I like to explain it to couples, that we're using what God gives us. And it's just an amazing blessing to have this opportunity to use what God gives us to help beautiful families come to be.
I suppose that we could also ask, and because there are other branches of medicine, where we also deal with interventions. So you mentioned chemotherapy for people who have cancer, and there is the issue of organ transplants, etc. For individuals who may have a damaged kidney or damaged heart or something to that effect. And there is medical intervention. So if we view this as a matter of medical intervention, of course, as I said, next week, we're going to go into some of the ethical dimensions of whether it's okay for me to use a sperm from somebody else, etc. We're going to talk about single people who want to get pregnant, those kinds of ethical dimensions.
Sure.
But let's take this question from one of our viewers. Is the age issue just applicable to the first pregnancy? We spoke earlier about when is a good time to have your eggs frozen, etc. Is the age issue applicable only to the first pregnancy?
That's an excellent question, and normally patients don't ask it that way, but I really like the way that the viewer asked that question. It's not, the age of the first pregnancy does not matter. It's really just making sure you've had your family before age 42, 44. So it doesn't matter if the woman has her first baby at age 30 or 25 or 40. It doesn't prolong their fertility when they have their first child at all. So, but we know it for whatever reason, for a woman after age 42, 95% of women will not get pregnant after 42. 99.9% of women will not get pregnant after age 44 with their own eggs, unless they had frozen eggs from a younger age, or they use a donor egg, where something like that. That's a great question. So and she's insinuating that if you had your first baby at age 20 versus age 30, does it change that endpoint of 42, 44? And it does not change the endpoint. It's just 99.99% of women will not get pregnant with their own eggs after age 44.
Okay, wonderful. Thank you so much. Here's another question. This one is speaking to some ethical considerations. Do you consider freezing an embryo and using it at a later date as being ethical? Well, I believe you would have answered that already, but I'll give you a chance.
Good question. As a God-believing scientific physician, I don't see any ethical dilemma or moral dilemma with having a cryopreserved life. I do consider the embryo that's frozen, or an embryo that's frozen is life, potentially could be life, so it needs to be respected. And for example, at our fertility center, we don't believe in discarding them. If couples want to destroy them, they have to send them to another fertility center to destroy them. So a fertilized egg or an embryo is a life, and we respect it as life. Now, a frozen egg is not life. A frozen egg is not life. So, but just having them cryopreserved, I don't see any moral or ethical dilemma. And just to give you, maybe to make it a little more real, we're very blessed where most of our patients will come to our fertility center and perform one IVF cycle, and they'll have their whole family. They'll have a beautiful family of 2 or 3 children typically. And then they may have some extra cryopreserved embryos in the freezer. And then the dilemma comes up. What do you do with these frozen embryos that are in the freezer and they don't want any more children? Most of our patients will donate them. We'll donate them to another couple. And that's where, or they'll use them. My wife and I had that problem. My wife and I actually had to live my job. That's where I lost a lot of my hair. But I actually did IVF with my wife, and we had completed our family from this wonderful God-given science. And we had extra embryos in the freezer, and we could have donated them. And as as God believers, we probably would have. But we said, well, let's go ahead and try. Even though we're finished with our family, why not use the cryopreserved embryos? It's pretty easy to use frozen embryos. So we used those frozen embryos, and we didn't get pregnant from those. And it's a long talk on why they take or why they don't take. But we felt blessed that God intended us to have 3 children in our family, even though we went through fertility treatment. And we were kind of happy that the remaining embryos didn't make life near the end. But I'm glad that we had respect for those embryos and gave them a try.
So what happens to the embryo, frozen embryo, if the person dies? So if I have an embryo in the freezer at the bank,
yes,
and I die, what happens to the embryo?
Well, there is a consent form. There's a contract on how do you disposition those embryos. And we have that all kind of written out where if the couple, unfortunately, let's say the husband and the wife die in a plane wreck or something horrible, that most couples the majority will donate them. And another couple that's desperate to have a family will use them and have children.
Okay, oh, wonderful. I was tempted to ask you about the donor aspect of that, if that's a big popular thing.
You know, it's amazing. To answer that quickly, you know, it's really interesting, and it's very popular to use donor embryo right now. So couples, especially where the woman has a bad egg count or the gentleman has bad sperm and they need to use donor egg or donor sperm, they'll use donor embryo because it's a lot more, it's very affordable. It's, you know, adoption, unfortunately, in the United States is $50,000 US, where donor embryo is only a few $1,000s. So it's much, much cheaper. So many couples use donor embryo to fulfill their family needs or children. And also we have couples coming in that don't even have infertility, Dr. Greene, where they don't even have infertility, but they feel morally and ethically this is their way of adopting, where they're using donor embryo to have children, which is fascinating to me. And it's really becoming very popular in the US for couples to use donor embryo, even when they don't have infertility.
That's very interesting. Now, I'm seeing a connection here between adoption and using donor eggs or embryos, and because if I were to adopt a child, now one thing you mentioned that it is pretty expensive, the adoption process.
Yes.
And using the donor embryo is much cheaper, but you also would feel a sense of attachment to that baby because you would be a part of the development of the child even before they were born. So that's to be honest, Doc, that's something I never thought about, you know, for couples who can't have children. That's amazing.
You're exactly right. And when we put these beautiful little wonderful frozen embryos into a couple accepting donor embryos, they immediately bond. And also we know that scientifically it's very interesting, Dr. Greene, where the woman, even though it's not her genetic egg and it's not his genetic sperm, her body, well, that little seed that we could barely even see under a microscope, grows in her body to become an 8-pound baby. There's this area of science called epigenetics where we know her body signals it to unravel differently. So there's certain things that she confers on that baby that would not have happened if that baby grew in somebody else's uterus. So the baby does become different also because it grew in her body. So there's a sense of satisfaction, or that I had something to do with the personhood of this donor embryo, became a little more part me, even though genetically it did come from this other couple. It does become a different individual, and we can expand on that in another discussion. But it gives couples a sense of satisfaction that they have more input on the creation of that child.
You know, I know we have a lot of questions, Doc, and of course we're going to be here next week, and if necessary, the next week. But I want to ask this question now because in these parts, at least to my knowledge, we don't often hear of people taking a fertility treatment, perhaps because to some extent our facilities do not offer those. If there's a person who's listening from the Caribbean, you know, I'm here in one of these small islands, Antigua. We refer to it as a little bit of paradise, but some of the facilities we don't have. And
Sure.
That individual is saying, hey, listen, I'm 38, I'm 35, 37, I'm married, I can't get children. You know, I never thought about this. What hope? What do they do?
So we see actually quite a few patients from the Caribbean, and you're right. You know, in a smaller population, even in the United States, smaller cities are not big enough to have a fertility center. So you typically will only find fertility centers in large cities of over 1 million people. And patients will fly and drive to our facilities. It's just nature of it. It takes a lot of resources to keep a fertility center going. We enjoy seeing a lot of patients from the Bahamas and the Caribbean in general, where they'll fly to Orlando and we'll provide treatments that are very efficient, where they only have to spend a week in the US. But we can do almost most of the time we'll have a phone consultation with the patient initially, or a telemedicine consultation with the patient. And then we can get all the necessary things involved. We actually have our nurses educate the patients in the Caribbean. And then when they come in, they only have to spend a week, and they can have necessary treatments and leave. And then at home, 2 weeks later, they can check a pregnancy test. And so we make it very efficient for those that have to fly in. And most fertility centers were built this way. And we have patients that fly to Orlando from Pennsylvania or California or China or Belgium. We have lots of patients flying to us from Brazil and the Caribbean, where a lot of these resources just aren't available in some of these areas. And so it is fairly common for us to treat and work with couples in the Caribbean with infertility.
Thank you so much. Let's go back to this other question now. This person is asking, would the woman have to undergo different tests to ensure that the frozen fertilized egg would implant into her uterus?
The uterus, that's a good question. And for example, when we go to use somebody's uterus, that, for example, it lives in the Caribbean, there is a simple test that usually a gynecologist in the Caribbean can do this, where we instruct the woman to see her gynecologist, and they do a simple test of her uterus called a saline hydrosonogram, or an HSG procedure, just to make sure that there's not a fibroid in the lining. But outside of that, that's the only test, and that can usually be done locally in the Caribbean. That's the only test that needs to be done, and the majority of the time that's not a problem. So usually it doesn't lead to issues. But if it did, we could organize it where the patient could fly to us, and we do simple minor surgeries to correct these issues. So the uterus is pretty easy to work with. We deal with problems like fibroids and polyps all the time.
Okay, wonderful. Now, another question, Doc. An embryo is often referred to as a human life. What if the person doesn't want to get a child or cannot have a child as planned? Does the medical institution discard the embryo or the life? Or I believe you answered that question earlier when I asked what happens if the person dies or doesn't want to.
When it comes to we are the same way. We are a God-believing fertility institute where we consider embryos life. And we know that not all embryos will make a baby, but we don't know which ones will make the baby and which ones will not. So we treat each one with respect. And it's the couple's property. So the fertility center does not own that couple's embryos. That couple owns their embryos, and they tell us how they want to have them handled. For example, let's say it's a couple that went through the IVF process and the egg and sperm were united. It became an embryo. They had their family. They had extra embryos in the freezer, and they didn't want any more children. Then there's a consent form where they would donate them to another couple. But if they wanted to destroy them, at a center like ours, we would not destroy them. They would send to a company like Reproductive or these other companies that would handle them and could potentially dispose of them. But the blessing there is most couples don't. The great majority of couples, like greater than 95% of the time, they donate their extra embryos. So it gives me a sense of good. You see the good in general in people that are respectful of their embryos. It's really heartwarming to see that most people respect life as well.
Now, this question was answered already, so I'll skip to another one. This question, just a few weeks ago, we're told to stay away from pregnancy after 35 due to breast cancer scare. So here's an individual who's saying, well, a pregnancy after 35 can have breast cancer implications.
Yeah, that's a good question. I don't think that's not the standard of care that we're held to. And a great website is the American Society for Reproductive Medicine. And in Europe, it's the ESHRE, or European Society for Human Reproduction, or ESHRE. Those are two great websites to go to. And no, that is not a general recommendation to avoid pregnancy after age 35 to avoid breast cancer. I don't believe that. Okay,
very well. Yeah. Next question. let's hear this one now. What if a Seventh Adventist unmarried sister desires to use one of those methods to become pregnant? Well, let's hold this question until next week, because next week we're going to be talking about ethical dimension. So next question, what about the story of Hannah having faith in God in application today? Does modern science have moral, ethical boundaries?
You know, I love, you know, the infertility figure in the Bible, one of them is Hannah's story, Hannah's prayer. And she was so desperate to have a baby, and she prayed to God so ardently, and God gave her Samuel. And that's my name, Sam. I love my name for my industry, for what I work in. And Samuel was God's gift. I don't know. Sometimes my wife says I'm not God's gift, but it's marriage. I suppose that's marriage. But Samuel was God's gift to Hannah, and she promised him back to the priest. She said, "You can have him and do with what you need back to the priest." And yes, God gifted her, and she was in her 70s potentially. And I do believe in miracles, and that was a miracle. And, you know, even though God gives us education and God gives us an understanding currently here on earth, and we know that, you know, study after study around the world shows that 99.99% of women will not get pregnant after 44. You see the miracles. You see the 48-year-old or the 49-year-old that gets pregnant on their own, and it amazes me. So miracles still exist, but God also gives us an education and a learning, and we from that we give recommendations. So God's all in this. We're not separate from God at all, and we love seeing miracles. So I do believe in Hannah's story, and I believe in the miracle of life, and this is all God-given blessings of family.
Let me ask you, as a physician, this. What's the difference? And I'm going to create a scenario here. Just to follow up on the Hannah issue. If I discover that I have, let's say, prostate cancer, I want to be real because I'm a man. If I discover I have prostate cancer, I pray to God and say, Lord, I want you to work a miracle in my life, heal me from prostate cancer. Or the discovery of having prostate cancer should send me to the doctor to get some treatment on that. How different is that from realizing I want to get a child? I say, Lord, help me to get pregnant. I'm married. I have a wife. She's producing eggs. How different are those two scenarios?
Well, let's use the Hannah's prayer scenario that way. I like it. So the gentleman has prostate cancer. So it depends on how so we would inform him, the cancer doctor would tell them to come to a fertility center and possibly cryopreserve their sperm for future use, maybe a few samples. And that's plenty for a whole family. But let's say the gentleman did not cryopreserve his sperm. And it depends on what treatment that gentleman's having. Will he have chemotherapy for his cancer that will kill, most of the time will kill all of the sperm producing cells? Or is it surgery that'll disrupt the plumbing where the sperm can't get out of the body? But, you know, there's still room here for miracles, where let's say the gentleman had surgery and they cut his prostate out. God could work the plumbing. Like, maybe it's not a guarantee that the plumbing will be severed, and maybe sperm can still work itself out of the body for natural conception. Or the gentleman had chemotherapy and it didn't kill all the sperm producing cells. And that gentleman, we would normally, after he completed chemo, we'd have him recheck a semen analysis anyhow, because the testicles may have withstood the blast of chemo and still had some sperm producing cells may have survived. So there's still God's hand can still work in all of this, and there could still be miracles. Absolutely. Yeah, but yeah, that's how I'd leave it. Yeah.
Well, we only have time for one more question today, Doc. Sure. I want to say this to all of our viewers. We are going to be back next week again. We will answer all of your questions. So please do not fear. A final question. How do we respond to the concerns that older persons may not be able to nurture and care for children? Isn't it selfish for parents to be obsessed with having children and not consider the needs of the child?
That's a very good question. Now physicians, at least in the United States, if we feel uncomfortable and there's an unethical situation, we don't have to treat the couple. We're not forced to by government. So if we feel uncomfortable in a situation, we don't have to treat them. And this will be our next discussion. There's lots of other interesting areas, such as let's say they're mentally incompetent people that come in. Like if they're wanting to use donor egg or donor sperm, then we make them get a psychological evaluation to prove that they're of consenting ability. And we as doctors determine if they're a physical ability to carry a pregnancy. But I've also learned not to be judgmental. I mean, is fertility only for smart people that are rich? Is it okay for people with lower IQs to have children? Sure it is. God doesn't intend family just for those of the highest IQ and the highest income. So I've learned to not be judgmental, and lots of couples have families for different reasons. And as I age, I've learned to not be judgmental over this. And if a couple generally wants to have a child, I see there's good in life. And but there are scenarios where, we have to medically, psychologically not work with couples potentially. But we're not just a factory. We look at the whole picture. We look at the mind body. We look at the whole picture. But I can tell you that medicine has humbled me, and God has humbled me to not be so judgmental. Yeah.
Well, Dr. Brown, I want to express profound thanks for your contribution to today's Let's Talk. It was just a delight. You have shared so many amazing insights into this area of fertility treatment and what happens if a couple cannot get pregnant. We are going to be back next week again. We're going to be talking about the ethical dimensions. There is so much more. I want Doc to be, you mentioned, I did share that you also do tubal reversal, and I hope we can sometime talk about that likewise. So to all of our viewers, we are going to be back next week, 3 p.m., same time. Well, of course, that is if you're in the Caribbean. I know that on tomorrow, the American Daylight Time ends, and so there's going to be a 1 hour difference. So if you're in North America, it's going to be 2 p.m. We wish you God's blessings. Thank you so much for joining us on Let's Talk. And Doc, we really do appreciate the wealth of information that you have been able to share with us. And given your extremely busy schedule, we do appreciate this a whole lot. God bless
Dr. Greene, thank you for the opportunity. It is my pleasure.
Most welcome.
Thank you.